Introduction to Clinical Nutrition. Clinical nutrition is a specialized field focusing on the role of nutrients in health and disease, particularly in a medical context. It involves applying nutritional science to prevent, diagnose, and treat various health conditions, often working alongside medical professionals. This discipline emphasizes how diet and nutrient intake impact physiological processes, disease progression, and patient recovery. Understanding clinical nutrition is crucial for promoting optimal health outcomes and managing complex medical cases. It encompasses a broad spectrum of topics, from basic nutrient functions to advanced dietary interventions. The field continuously evolves with new scientific discoveries and evidence-based practices. Practitioners in this area play a vital role in patient care. The scope of clinical nutrition extends to various settings, including hospitals, outpatient clinics, long-term care facilities, and private practices. Clinical nutritionists assess patients' nutritional status, develop personalized meal plans, and provide education on dietary modifications. They address issues such as malnutrition, nutrient deficiencies, food allergies, and chronic diseases like diabetes and heart disease. Their work often involves collaborating with doctors, nurses, and other healthcare providers to ensure integrated patient care. This interdisciplinary approach is essential for holistic treatment and achieving sustainable health improvements. Effective communication and a deep understanding of medical conditions are paramount for success in this field. Macronutrients. Carbohydrates. Carbohydrates are the body's primary source of energy, essential for fueling daily activities and maintaining vital organ functions. They are organic compounds composed of carbon, hydrogen, and oxygen, classified into simple and complex forms. Simple carbohydrates, like sugars, provide quick energy but offer limited nutritional value. Complex carbohydrates, found in whole grains and vegetables, release energy slowly and provide sustained fuel. These complex forms are crucial for stable blood sugar levels and overall metabolic health. Dietary fiber, a type of carbohydrate, aids digestion and promotes gut health. Understanding carbohydrate types is fundamental for balanced nutrition. Dietary sources of carbohydrates include fruits, vegetables, grains, legumes, and dairy products. Whole grains, such as oats, brown rice, and quinoa, are excellent sources of complex carbohydrates and fiber. Fruits and vegetables provide natural sugars along with vitamins, minerals, and antioxidants. Clinical relevance of carbohydrates involves managing blood glucose levels, especially for individuals with diabetes, and ensuring adequate energy intake for athletes. Imbalances in carbohydrate consumption can lead to various health issues, including obesity, insulin resistance, and digestive problems. Proper carbohydrate selection is a cornerstone of a healthy diet. Macronutrients. Proteins. Proteins are fundamental macromolecules essential for virtually every biological process within the body. They are composed of amino acids, which are linked together in long chains, forming complex three-dimensional structures. Proteins serve numerous critical functions, including building and repairing tissues, producing enzymes and hormones, and supporting immune function. There are 20 different amino acids, 9 of which are considered essential because the body cannot synthesize them and must obtain them from the diet. Complete proteins contain all essential amino acids, while incomplete proteins lack one or more. Understanding protein structure and function is vital for appreciating their role in health. Excellent dietary sources of protein include lean meats, poultry, fish, eggs, dairy products, legumes, nuts, and seeds. Plant-based proteins can be combined to provide all essential amino acids, making them suitable for vegetarian and vegan diets. Clinically, protein intake is crucial for muscle repair after injury or surgery, maintaining muscle mass in older adults, and supporting growth in children. Protein deficiency can lead to muscle wasting, impaired immune function, and delayed wound healing. Conversely, excessive protein intake can sometimes strain the kidneys, though this is less common. Balancing protein intake according to individual needs is key for optimal health. Macronutrients. Fats. Fats, also known as lipids, are crucial macronutrients that serve multiple vital functions in the body, despite their often misunderstood reputation. They are concentrated sources of energy, providing more than twice the energy per gram compared to carbohydrates or proteins. Fats are essential for absorbing fat-soluble vitamins A, D, E, K, and for producing hormones. They also provide insulation, protect organs, and contribute to cell membrane structure. Different types of fats exist, including saturated, unsaturated, monounsaturated, and polyunsaturated, and trans fats, each with distinct effects on health. Understanding these distinctions is critical for making informed dietary choices. Dietary sources of healthy fats include avocados, nuts, seeds, olive oil, and fatty fish like salmon. Saturated fats are primarily found in animal products and some plant oils, while trans fats are often found in processed foods. Clinically, the type and amount of fat consumed significantly impact cardiovascular health, cholesterol levels, and inflammation. Excessive intake of unhealthy fats can contribute to heart disease and obesity, whereas adequate intake of healthy fats supports brain function and reduces disease risk. Nutritional guidance often focuses on replacing saturated and trans fats with unsaturated fats to promote better health outcomes. Balancing fat intake is a delicate but essential aspect of clinical nutrition. Micronutrients, vitamins, fat-soluble. Fat-soluble vitamins, specifically A, D, E, and K, are essential organic compounds that play diverse and critical roles in maintaining human health. Unlike water-soluble vitamins, these are absorbed with dietary fats and stored in the body's fatty tissues and liver. This storage capacity means they can accumulate, and excessive intake can lead to toxicity, making careful monitoring important. Each of these vitamins has unique functions, ranging from vision and bone health to antioxidant protection and blood clotting. Their absorption is often dependent on the presence of dietary fat and a healthy digestive system. Understanding their specific roles and sources is key. Vitamin A is vital for vision, immune function, and cell growth, found in carrots, sweet potatoes, and liver. Vitamin D is crucial for bone health and calcium absorption, synthesized in the skin upon sun exposure, and found in fatty fish and fortified dairy. Vitamin E acts as a powerful antioxidant, protecting cells from damage, abundant in nuts, seeds, and vegetable oils. Vitamin K is essential for blood clotting and bone metabolism, with sources including leafy green vegetables and some fermented foods. Deficiencies in these vitamins can lead to specific health problems, while excessive supplementation can also pose risks. Balanced intake through diet is generally preferred. Micronutrients, vitamins, water-soluble. Water-soluble vitamins, encompassing the B-complex vitamins and vitamin C, are essential nutrients that dissolve in water and are not readily stored in the body. This means they need to be consumed regularly through the diet to prevent deficiencies. Unlike fat-soluble vitamins, excess amounts are typically excreted in urine, reducing the risk of toxicity, though extremely high doses can still cause adverse effects. These vitamins play crucial roles as coenzymes in numerous metabolic processes, supporting energy production, nerve function, and red blood cell formation. Their constant turnover necessitates a consistent dietary supply. Understanding their unique properties is vital for nutritional planning. The B-complex vitamins include thiamine, B1, riboflavin, B2, niacin, B3, pantothenic acid, B5, pyridoxine, B6, biotin, B7, folate, B9, and cobalamin, B12. They are widely distributed in whole grains, legumes, meat, and leafy greens. Vitamin C, or ascorbic acid, is a powerful antioxidant crucial for immune function, collagen synthesis, and iron absorption, found abundantly in citrus fruits, berries, and bell peppers. Deficiencies in water-soluble vitamins can lead to conditions like scurvy, vitamin C, pellagra, niacin, and anemia, folate, B12. Ensuring a diverse diet, rich in fruits, vegetables, and whole grains, is the best strategy for adequate intake. Micronutrients, major minerals. Major minerals including calcium, phosphorus, magnesium, sodium, potassium, and chloride are essential inorganic nutrients required by the body in larger quantities compared to trace minerals. These minerals play pivotal roles in maintaining fluid balance, nerve function, muscle contraction, and bone structure. They are not synthesized by the body and must be obtained through diet. Each major mineral has distinct physiological functions, and imbalances can lead to significant health issues. Understanding their dietary sources and recommended intakes is crucial for preventing deficiencies and excesses. Their widespread involvement in bodily processes underscores their importance. Calcium and phosphorus are vital for bone and teeth formation, found in dairy, leafy greens, and nuts. Magnesium supports muscle and nerve function, blood glucose control, and blood pressure regulation, abundant in nuts, seeds, and whole grains. Sodium and potassium are critical for fluid balance, nerve impulse transmission, and muscle contractions, with sodium common in processed foods and potassium plentiful in fruits and vegetables. Chloride works with sodium to maintain fluid balance. Clinical implications of major mineral imbalances range from osteoporosis and muscle cramps to hypertension and cardiac arrhythmias. A balanced diet rich in whole foods is the best way to ensure adequate intake of these essential minerals. Micronutrients, trace minerals. Trace minerals, though required in much smaller quantities than major minerals, are equally vital for numerous physiological functions. These include iron, zinc, copper, selenium, iodine, manganese, fluoride, chromium, and molybdenum. Despite their minute requirements, deficiencies or excesses of trace minerals can lead to severe health consequences. They often function as cofactors for enzymes, participating in metabolism, immune response, and antioxidant defense. Their bioavailability can be influenced by other dietary components, making balanced dietary patterns crucial. Understanding the specific roles and sources of each trace mineral is essential for comprehensive nutritional assessment and intervention. Iron is critical for oxygen transport in blood and energy metabolism, found in red meat, legumes, and fortified cereals. Zinc supports immune function, wound healing, and DNA synthesis, abundant in meat, shellfish, and nuts. Copper is involved in iron metabolism and antioxidant defense, present in organ meats, nuts, and seeds. Selenium acts as an antioxidant and supports thyroid function, found in Brazil nuts, seafood, and grains. Iodine is essential for thyroid hormone production, primarily from iodized salt and seafood. Deficiencies in trace minerals can cause conditions like anemia, iron, impaired immunity, zinc, and goiter, iodine. A varied diet is key to meeting these micronutrient needs. Water and electrolytes. Water is the most abundant and essential nutrient for human life, comprising approximately 50 to 70% of an adult's body weight. It plays an indispensable role in virtually all bodily functions, including regulating body temperature, transporting nutrients and oxygen, lubricating joints, and acting as a solvent for metabolic reactions. Maintaining proper hydration is critical for cellular function, organ performance, and overall health. Dehydration can lead to fatigue, impaired cognitive function, and severe physiological disturbances. Conversely, overhydration, though less common, can also be dangerous. Understanding water's role is foundational to clinical nutrition. Electrolytes are minerals that carry an electric charge when dissolved in body fluids, such as sodium, potassium, chloride, calcium, and magnesium. They are crucial for maintaining fluid balance, nerve impulse transmission, muscle contraction, and pH balance. Imbalances in electrolytes, often due to dehydration, excessive sweating, vomiting, or certain medical conditions, can lead to serious health issues like cardiac arrhythmias and neurological dysfunction. Clinical nutrition often involves monitoring and managing electrolyte levels, especially in hospitalized patients or those with specific medical conditions. Ensuring adequate fluid and electrolyte intake is a cornerstone of supportive care and disease management. Energy metabolism refers to the biochemical processes by which the body converts food into energy, primarily in the form of adenosine triphosphate, ATP. This complex series of reactions involves breaking down macronutrients, carbohydrates, fats, and proteins to release their stored chemical energy. ATP is the universal energy currency of the cell, powering all cellular activities, from muscle contraction to nerve impulse transmission. Understanding these metabolic pathways is fundamental to clinical nutrition, as it dictates how the body utilizes nutrients and how energy balance impacts health. Efficient energy production is vital for maintaining physiological functions. Various factors influence metabolic rates. Key metabolic pathways include glycolysis, the Krebs cycle, citric acid cycle, and oxidative phosphorylation, which collectively generate ATP. The basal metabolic rate, BMR, represents the energy expended at rest to maintain vital functions, while the total energy expenditure, TEE, includes BMR, physical activity, and the thermic effect of food. Factors like age, gender, body composition, and activity level influence BMR and TEE. Clinical nutritionists use these concepts to estimate individual energy needs, develop appropriate dietary plans for weight management, and support patients with metabolic disorders. Accurate assessment of energy requirements is crucial for effective nutritional intervention. Nutritional assessment methods. Nutritional assessment is a systematic process of evaluating an individual's nutritional status to identify deficiencies, excesses, or imbalances. This comprehensive approach involves collecting and interpreting various types of data to form a complete picture of a person's dietary intake and health. Accurate assessment is the cornerstone of effective clinical nutrition, guiding the development of appropriate interventions and monitoring their effectiveness. It helps in identifying individuals at nutritional risk and tailoring interventions to their specific needs. Without thorough assessment, nutritional interventions may be ineffective or even harmful. This process requires a multifaceted approach. Common nutritional assessment methods include anthropometric measurements, biochemical analyses, clinical evaluations, and dietary assessments. Anthropometry involves measuring body size and composition, such as weight, height, body mass index, BMI, and skin fold thickness. Biochemical analyses involve laboratory tests of blood, urine, and tissue samples to measure nutrient levels and metabolic markers. Clinical evaluations involve physical examinations to identify signs of nutrient deficiencies or toxicities. Dietary assessments involve collecting information about food and nutrient intake using methods like 24-hour recalls, food frequency questionnaires, and food diaries. Combining these methods provides a holistic view of nutritional status. Dietary reference intakes, DRIs. Dietary reference intakes, DRIs, are a set of nutrient reference values developed by health authorities in the United States and Canada to plan and assess nutrient intakes for healthy people. They provide quantitative estimates of nutrient intakes to be used for planning and evaluating diets for individuals and groups. DRIs are crucial tools for clinical nutritionists, public health professionals, and policymakers in developing dietary guidelines and assessing nutritional adequacy. They help prevent both nutrient deficiencies and toxicities, promoting optimal health across different life stages. Understanding the various components of DRIs is fundamental for applying nutritional science effectively. The DRIs comprise several categories: recommended dietary allowance, RDA, adequate intake, AI, tolerable upper intake level, UL, and estimated average requirement, EAR. The RDA is the average daily dietary intake level, sufficient to meet the nutrient requirements of nearly all 97 to 98% healthy individuals in a particular life stage and gender group. AI is used when an RDA cannot be determined, based on observed or experimentally determined approximations. UL is the highest daily nutrient intake level likely to pose no risk of adverse health effects. EAR is the average daily nutrient intake level, estimated to meet the requirements of half of the healthy individuals. Each component serves a specific purpose in nutritional planning and assessment. Medical nutrition therapy, MNT. Medical nutrition therapy, MNT, is an evidence-based medical approach to treating chronic diseases and conditions through an individually tailored nutrition plan. It is provided by a registered dietitian nutritionist, RDN, and involves a comprehensive assessment of a patient's nutritional status, followed by the development and implementation of a personalized nutrition care plan. MNT is not merely about providing dietary advice. It involves a deep understanding of pathophysiology, nutrient metabolism, and the interaction between food and medications. The goal is to manage, treat, or prevent various health conditions, improving patient outcomes and quality of life. MNT is a critical component of holistic healthcare. The role of the clinical nutritionist in MNT is multifaceted, encompassing assessment, diagnosis, intervention, and monitoring. They educate patients on the relationship between nutrition and their health condition, helping them make sustainable dietary and lifestyle changes. Examples of conditions managed with MNT include diabetes, cardiovascular diseases, kidney disease, gastrointestinal disorders, and cancer. MNT can significantly impact disease progression, reduce symptoms, and prevent complications. It often involves close collaboration with other healthcare professionals to ensure integrated care. Effective MNT requires ongoing patient education and support to achieve long-term success. Nutrition for weight management. Nutrition plays a pivotal role in weight management, addressing both obesity and underweight conditions. Obesity, characterized by excessive body fat, is a major public health concern linked to numerous chronic diseases, including diabetes, heart disease, and certain cancers. Underweight, though less common, can also lead to health issues like weakened immune function and nutrient deficiencies. Effective weight management involves achieving a healthy energy balance, where energy intake matches energy expenditure. Clinical nutritionists develop individualized strategies that focus on sustainable dietary changes, behavioral modifications, and increased physical activity. It is a complex process that requires a holistic approach. Dietary strategies for weight management often involve controlling portion sizes, increasing intake of nutrient-dense foods like fruits, vegetables, and lean proteins, and reducing consumption of energy-dense, nutrient-poor foods. Behavioral changes include mindful eating, setting realistic goals, and identifying triggers for unhealthy eating patterns. For individuals with obesity, a gradual, consistent weight loss is typically recommended to promote long-term success. For underweight individuals, strategies focus on increasing calorie and nutrient intake through healthy, energy-dense foods. Clinical nutritionists provide education, support, and monitoring to help patients achieve and maintain a healthy weight, emphasizing sustainable lifestyle changes over restrictive diets. Nutrition for diabetes mellitus. Nutrition is a cornerstone of managing diabetes mellitus, a chronic condition characterized by high blood glucose levels. Effective dietary management is crucial for both type 1 and type 2 diabetes, as well as gestational diabetes. For type 1 diabetes, which involves insufficient insulin production, dietary management focuses on balancing carbohydrate intake with insulin doses to maintain stable blood sugar. For type 2 diabetes, often associated with insulin resistance, nutrition therapy aims to improve insulin sensitivity, manage weight, and control blood glucose. Gestational diabetes requires careful dietary control to prevent complications for both mother and baby. Understanding the impact of food on blood sugar is paramount. Medical nutrition therapy for diabetes emphasizes carbohydrate counting, portion control, and choosing nutrient-dense foods. Carbohydrate counting involves tracking carbohydrate intake to match it with insulin or medication, providing flexibility in meal planning. Patients are educated on the glycemic index and glycemic load of foods to understand their impact on blood sugar. Emphasis is placed on whole grains, lean proteins, healthy fats, and abundant fruits and vegetables. Limiting added sugars and highly processed foods is also critical. Clinical nutritionists work closely with patients to develop individualized meal plans, provide ongoing education, and monitor blood glucose levels to achieve optimal glycemic control and prevent long-term complications. Nutrition for cardiovascular diseases. Nutrition plays a critical role in the prevention and management of cardiovascular diseases, CVDs, which include conditions like hypertension, dyslipidemia, abnormal lipid levels, coronary artery disease, and heart failure. Dietary interventions are often the first line of defense and a crucial component of treatment plans. Unhealthy dietary patterns contribute significantly to the development and progression of CVDs. Clinical nutrition aims to modify these patterns to reduce risk factors and improve heart health. Understanding the specific nutrients and food components that impact cardiovascular health is essential for effective intervention. A heart-healthy diet can significantly improve patient outcomes. Dietary recommendations for cardiovascular disease typically focus on reducing saturated and trans fats, dietary cholesterol, and sodium intake, while increasing consumption of fruits, vegetables, whole grains, lean proteins, and healthy unsaturated fats. For hypertension, reducing sodium and increasing potassium intake are key. For dyslipidemia, emphasis is placed on soluble fiber, plant sterols, and omega-3 fatty acids. In heart failure, fluid and sodium restriction may be necessary. Clinical nutritionists provide individualized counseling, helping patients implement these changes through practical meal planning and education. They monitor progress and adjust recommendations to optimize cardiovascular health and prevent complications. Nutrition for gastrointestinal disorders. Nutrition plays a crucial role in managing various gastrointestinal (GI) disorders, which affect the digestive system and can significantly impact nutrient absorption and overall quality of life. Conditions such as irritable bowel syndrome (IBS), Crohn's disease, celiac disease, and gastroesophageal reflux disease (GERD) often require specific dietary modifications to alleviate symptoms, promote healing, and prevent complications. The gut microbiome also plays a significant role in GI health, and diet can profoundly influence its composition and function. Clinical nutritionists are vital in guiding patients through complex dietary changes tailored to their specific GI condition. Understanding the intricate relationship between food and gut health is paramount. Dietary approaches for GI disorders vary widely depending on the specific condition. For celiac disease, a strict gluten-free diet is essential. For IBS, a low FODMAP diet may be recommended to reduce fermentable carbohydrates. Patients with inflammatory bowel diseases like Crohn's or ulcerative colitis may require specific diets during flare-ups and remission, often focusing on easily digestible foods and sometimes enteral nutrition. GERD management often involves avoiding trigger foods and modifying eating habits. Clinical nutritionists assess individual tolerance, provide education on food choices, and help patients navigate complex dietary restrictions while ensuring adequate nutrient intake. Personalized guidance is key to managing these challenging conditions effectively. Nutrition for renal diseases. Nutrition therapy is a critical component in the management of renal, kidney diseases, as the kidneys play a vital role in filtering waste products and maintaining fluid and electrolyte balance. As kidney function declines, dietary modifications become essential to reduce the workload on the kidneys, prevent the accumulation of toxins, and manage complications. Medical nutrition therapy, MNT, for renal disease is highly individualized and complex, requiring careful monitoring and adjustment. It aims to slow the progression of kidney disease, alleviate symptoms, and improve the patient's quality of life. Understanding the specific nutrient restrictions and requirements is paramount. Dietary management for renal disease often involves careful control of protein, sodium, potassium, phosphorus, and fluid intake. Protein intake may be restricted in pre-dialysis chronic kidney disease to reduce waste products, but increased for patients on dialysis. Sodium restriction is crucial to manage fluid retention and blood pressure. Potassium and phosphorus may also need to be limited, depending on blood levels, as impaired kidneys struggle to excrete them. Fluid intake is often restricted in later stages of kidney disease or for patients on dialysis. Clinical nutritionists work closely with nephrologists to develop personalized meal plans, educate patients on food choices, and monitor their nutritional status to prevent malnutrition and manage symptoms effectively. Nutrition for liver diseases. Nutrition plays a vital role in supporting liver function and managing various liver diseases, such as cirrhosis, hepatitis, and fatty liver disease. The liver is a central metabolic organ involved in nutrient processing, detoxification, and bile production. When liver function is impaired, it can lead to significant nutritional complications, including malnutrition, fluid imbalances, and impaired metabolism of macronutrients. Medical nutrition therapy, MNT, aims to support liver regeneration, prevent further damage, manage symptoms, and improve overall patient outcomes. Understanding the specific nutritional needs and challenges associated with different liver conditions is crucial. Proper dietary management can significantly impact disease progression. Dietary recommendations for liver diseases are highly individualized, depending on the specific condition and its severity. For patients with cirrhosis, adequate protein intake is crucial to prevent muscle wasting, but careful monitoring is needed to avoid hepatic encephalopathy. Energy intake must be sufficient to prevent malnutrition. Sodium and fluid restriction may be necessary to manage ascites and edema. For fatty liver disease, weight loss, a balanced diet, and avoidance of alcohol are key. Clinical nutritionists assess the patient's nutritional status, provide education on appropriate food choices, and monitor for complications. They work collaboratively with hepatologists to optimize nutritional support and improve liver health. Nutrition for cancer. Nutrition plays a critical and complex role in cancer care, influencing treatment tolerance, recovery, and quality of life. Cancer and its treatments can significantly impact a patient's nutritional status, often leading to malnutrition, weight loss, and cachexia, severe muscle wasting. Medical nutrition therapy, MNT, aims to prevent or treat malnutrition, manage treatment-related side effects, support immune function, and maintain strength and energy levels. The nutritional needs of cancer patients are highly individualized and can change throughout the course of treatment. Understanding these dynamic needs is essential for effective supportive care. Proper nutrition can significantly improve patient outcomes. Dietary strategies for cancer patients focus on managing common side effects like nausea, vomiting, loss of appetite, taste changes, and difficulty swallowing. This often involves frequent, small, nutrient-dense meals, soft foods, and adequate hydration. For patients experiencing cachexia, strategies focus on increasing calorie and protein intake to preserve muscle mass. Specific nutrient recommendations may vary based on the type of cancer, treatment regimen, and individual tolerance. Clinical nutritionists work as integral members of the oncology team, providing personalized counseling, recommending nutritional supplements if needed, and educating patients and their families. Their goal is to optimize nutritional status to help patients better tolerate treatment and improve their overall well-being. Pediatric nutrition focuses on the unique dietary needs of infants, children, and adolescents, recognizing that nutritional requirements change rapidly during different stages of growth and development. Proper nutrition during these critical periods is essential for optimal physical growth, cognitive development, and long-term health. Malnutrition, whether undernutrition or overnutrition, can have profound and lasting effects on a child's health and well-being. Clinical nutritionists specializing in pediatrics address a wide range of issues, from infant feeding and childhood obesity to managing allergies and chronic diseases in children. Understanding these distinct needs is crucial for promoting healthy development. Key aspects of pediatric nutrition include promoting breastfeeding for infants, introducing appropriate complementary foods, ensuring adequate intake of macronutrients and micronutrients for growing children, and addressing common nutritional issues. Childhood obesity is a significant concern, requiring family-centered interventions focused on healthy eating habits and increased physical activity. Food allergies and intolerances are also prevalent, necessitating careful dietary management. For children with chronic diseases, such as cystic fibrosis or congenital heart disease, specialized nutritional support is often required. Clinical nutritionists provide guidance to parents and caregivers, develop individualized feeding plans, and monitor growth and development to ensure children receive the best possible nutritional care. Geriatric nutrition. Geriatric nutrition focuses on the unique dietary needs of older adults, recognizing that physiological changes associated with aging significantly impact nutritional status. As individuals age, metabolic rates decrease, body composition shifts, and nutrient absorption can become less efficient. These changes, coupled with potential chronic diseases, polypharmacy, and social factors, increase the risk of malnutrition, sarcopenia, muscle loss, and bone health issues. Optimal nutrition in older adults is crucial for maintaining functional independence, improving quality of life, and preventing age-related diseases. Clinical nutritionists play a vital role in addressing these complex nutritional challenges. Understanding these specific needs is paramount. Key nutritional considerations for older adults include ensuring adequate protein intake to prevent sarcopenia, sufficient calcium and vitamin D for bone health, and fiber for digestive regularity. Hydration is also a common concern. Strategies often involve promoting nutrient-dense foods, addressing appetite changes, and managing interactions between food and medications. For older adults with dysphagia, difficulty swallowing, or cognitive impairment, modified food textures and feeding assistance may be necessary. Clinical nutritionists conduct thorough assessments, develop individualized meal plans, and provide education to older adults and their caregivers. Their goal is to support healthy aging and address specific nutritional deficiencies or excesses. Sports nutrition. Sports nutrition is a specialized field that focuses on optimizing the dietary intake of athletes to enhance performance, promote recovery, and maintain overall health. Athletes have unique energy and nutrient requirements that vary based on their sport, training intensity, and individual goals. Proper nutrition is crucial for fueling workouts, repairing muscle tissue, preventing injuries, and supporting immune function. Without adequate and appropriate nutrition, athletes may experience fatigue, impaired performance, and increased risk of illness or injury. Clinical nutritionists specializing in sports nutrition provide evidence-based guidance to help athletes achieve their full potential. Understanding these specific needs is paramount. Key aspects of sports nutrition include ensuring adequate energy intake to support training demands, optimizing macronutrient timing and composition, and maintaining proper hydration. Carbohydrates are essential for fueling exercise and replenishing glycogen stores. Protein is critical for muscle repair and growth. Healthy fats provide sustained energy and support hormone production. Hydration strategies are vital to prevent dehydration and maintain performance. Clinical nutritionists develop personalized meal plans, advise on pre- and post-workout nutrition, and evaluate the appropriate use of supplements. They work with athletes to integrate nutritional strategies into their training regimens, helping them achieve peak performance and long-term health. Enteral and parenteral nutrition. Enteral and parenteral nutrition are specialized methods of providing nutrients to patients who cannot adequately meet their nutritional needs through oral intake. Enteral nutrition involves delivering liquid nutrients directly into the gastrointestinal tract, typically via a feeding tube. This method is preferred when the gut is functional but oral intake is insufficient or impossible. Parenteral nutrition, on the other hand, involves delivering nutrients intravenously, bypassing the digestive system entirely. This method is used when the gastrointestinal tract is not functional or cannot absorb nutrients. Both methods are critical in clinical settings for supporting critically ill or malnourished patients. Understanding their indications and management is vital. Indications for enteral nutrition include dysphagia, severe malnutrition, critical illness, and certain GI disorders. It can be delivered through nasogastric, nasojejunal, gastrostomy, or jejunostomy tubes. Parenteral nutrition is indicated for conditions like severe malabsorption, intestinal obstruction, short bowel syndrome, or prolonged bowel rest. It can be total parenteral nutrition, TPN, providing all nutrients, or peripheral parenteral nutrition, PPN, for shorter-term or supplemental use. Clinical nutritionists play a crucial role in assessing patient needs, determining the appropriate type and formula of nutrition, calculating nutrient requirements, and monitoring for complications. They work closely with the medical team to ensure safe and effective delivery of these life-sustaining therapies. Food allergies and intolerances. Food allergies and intolerances are adverse reactions to food, but they differ significantly in their underlying mechanisms and severity. A food allergy is an immune system response to a specific food protein, which can trigger a range of symptoms, from mild, hives, swelling, to severe and life-threatening, anaphylaxis. Even a tiny amount of the allergen can cause a reaction. Food intolerances, on the other hand, are non-immune reactions, often involving the digestive system, and are typically less severe. They usually occur when the body has difficulty digesting a particular food component, such as lactose or gluten. Understanding the distinction is crucial for diagnosis and management. Common food allergens include peanuts, tree nuts, milk, eggs, soy, wheat, fish, and shellfish. Diagnosis of food allergies often involves skin prick tests, blood tests, and supervised oral food challenges. Management primarily involves strict avoidance of the allergen and carrying emergency medication, example epinephrine autoinjector, for severe allergies. Food intolerances, such as lactose intolerance or non-celiac gluten sensitivity, are managed by limiting or avoiding the problematic food to a tolerable level. Clinical nutritionists play a vital role in educating patients and families on allergen avoidance, reading food labels, identifying hidden ingredients, and ensuring adequate nutrient intake despite dietary restrictions. They help individuals navigate complex food environments safely and effectively. Ethical and professional practice is paramount in clinical nutrition, guiding practitioners in their interactions with patients, colleagues, and the healthcare system. Clinical nutritionists adhere to a strict code of ethics that emphasizes patient autonomy, beneficence, acting in the patient's best interest, non-maleficence, doing no harm, and justice. This includes maintaining confidentiality, providing evidence-based care, respecting cultural and personal beliefs, and avoiding conflicts of interest. Professionalism also involves continuous learning, maintaining competence, and upholding the integrity of the profession. Adherence to these principles ensures high-quality, patient-centered care and builds trust within the community. Ethical dilemmas are common in healthcare. The scope of practice for clinical nutritionists is defined by their education, training, and licensure, outlining the services they are qualified to provide. Effective patient counseling requires excellent communication skills, empathy, and the ability to translate complex scientific information into understandable, actionable advice. Clinical nutritionists often work as part of an interdisciplinary healthcare team, collaborating with physicians, nurses, pharmacists, and other specialists to provide comprehensive patient care. This collaboration ensures a holistic approach to treatment and optimal patient outcomes. Maintaining professional boundaries, advocating for patients, and engaging in lifelong learning are all crucial components of ethical and professional practice in clinical nutrition.